How scorpions sting you. The science behind their bite. Scorpions are among the most fascinating and feared arthropods in the world. Their stinger, located at the end of a curved tail, is a perfect weapon evolved over millions of years. But how exactly does a scorpion sting you, and what happens when it does? Understanding this process requires looking at both their anatomy and behavior. A scorpion's tail, or metasoma, ends in a sharp stinger called the telson. Inside the telson is a venom gland that produces a complex mixture of toxins. When threatened or hunting, a scorpion arches its tail over its body and uses the stinger like a hypodermic needle. The stinger can penetrate the skin with remarkable precision, even through thick clothing or tough surfaces in some cases. The actual act of stinging is fast and controlled. Scorpions are ambush predators, so their strike is usually quick and accurate. They first sense vibrations or chemical signals in their environment, locating prey or detecting threats. Then, in a fraction of a second, they lash their tail forward, puncture the skin, and inject venom directly into the target. The amount of venom depends on the species, size, and whether the scorpion is hunting or defending itself. Once injected, the venom begins to act immediately. Scorpion venom is primarily neurotoxic, meaning it affects the nervous system. It can interfere with nerve signals, causing intense pain, numbness, or even paralysis in smaller prey. In humans, the severity varies by species. Most stings are painful but not life-threatening, causing localized swelling, redness, and tingling. However, stings from highly venomous species can trigger systemic reactions, including muscle spasms, breathing difficulties, or, in rare cases, cardiac complications. Interestingly, scorpions control how much venom they release. They often deliver dry stings with little or no venom when warning predators or conserving their supply for hunting. This makes encounters with humans sometimes less dangerous than they appear. Scorpions also rely on their pincers to capture or subdue prey, so the sting is often a last resort. Preventing a sting is largely about awareness and caution. Scorpions are nocturnal, hiding under rocks, logs, or debris during the day. Wearing protective gloves, shaking out shoes and clothing, and using a flashlight at night can reduce the risk. In areas with venomous species, medical attention is crucial if stung, especially for chill.
What do you do if a scorpion stings you? First, don't panic. I know, easier said than done, but staying calm is crucial. Panicking speeds up your heart rate, which can make the venom spread faster. So, take a deep breath. Most scorpion stings are painful but not life-threatening. Your next move is to gently wash the sting area with soap and water. This helps prevent infection. After that, grab a cold pack or some ice wrapped in a towel and apply it to the sting for about 10 minutes. This will help reduce the pain and swelling and slow down the venom's absorption. Just remember to take breaks and don't put ice directly on your skin. If the sting is on an arm or leg, try to keep it elevated to about heart level and take off any tight clothing or jewelry, like rings or bracelets, from around the area before it starts to swell. For the pain, a simple painkiller like paracetamol can help. But what you absolutely should not do is cut the wound, try to suck out the venom, or apply any weird stuff like alcohol or herbal pastes. These are old myths and can actually make things much worse. Now, you need to watch for serious symptoms, especially in kids or older adults. If you see things like severe muscle twitching, trouble breathing, vomiting, or a super fast heartbeat, it's time to get to a hospital right away. These could be signs of a more dangerous reaction that needs professional medical attention. In the hospital, they can manage the pain and, in severe cases, might use antivenom. The good news is, with the right care, most people feel much better within a day or two. The best defense is to avoid getting stung in the first place. Always shake out your shoes and clothes before putting them on. And be careful when moving rocks or wood in areas where scorpions live. So to recap, stay calm, clean the wound, apply a cold compress, manage the pain, and seek medical help if serious symptoms appear. Stay safe out there. Thanks for watching, and don't forget to subscribe for more helpful tips.